Hi, I'm Kevin Savage. I'm a physical therapist for Athletico. I've been practicing about 20 years. I completed a fellowship training about a year ago. Been needling about 5 years.
How has needling changed your practice?
I'd say the biggest thing is I feel like I can make a positive impact more quickly on a lot of patients, whether it's patients presenting with acute symptoms or chronic. I can see a positive change quickly, which then results in faster recovery.
And how do you work with your colleagues who do not do dry needling in your clinic? How is that working out?
Yeah, it's good. Of course, I'm the only one at the clinic that needles, so if they get stuck or they have a patient they think might benefit from needling, they'll send them my way. And I also will get patients sent to me from other clinics. We have a bunch of clinics in the western suburbs of Chicago, and some clinicians send me their patients from other clinics as well. So it's been personally good for my own practice to build our volume at our clinic and my personal volume.
And have you noticed that physicians recognize dry needling? Do physicians refer specifically to you for dry needling?
The first year or two I did it, not really, but the last couple of years I have had several patients that sought my care because I needled, and it was their physician that actually said, hey, maybe you should try needling. You've tried formal therapy in the past, which didn't help, but maybe needling might help you. So I've gotten a bunch the past couple of years, yeah.
Do you have any interesting cases you'd like to share?
There's been a bunch, but there's two that stand out in my mind. One of them was a patient that had chronic plantar fascia pain that came in for about 3 weeks, and we really didn't make much change. And I told her about needling. I said, hey, we haven't tried this yet. Maybe this will help. And I palpated around the medial head of her gastroc, which was really tender, found a couple trigger points. It didn't produce her heel pain, but I thought, hey, we could try this. We haven't done it yet. And so I needled the medial head of the gastroc, and she got off the table and had no pain. I was actually a little surprised myself. I saw her a couple days later, still had no pain at all since I needled her. I saw her the following week, still no pain. I mean, it was almost miraculous. And then I had another patient that was in a car accident, presented with headaches and whiplash-associated disorder that I saw, again, for a few weeks. And she was progressing a little bit, but the headaches were not getting any better. And after about 3 or 4 weeks, I was kind of palpating her SCM on one side, and I was able to reproduce her headache. So I told her about the needling, that I was certified by Myopain, and I said, this might really help you. We found this trigger point, it's producing your symptoms. So she was open to it, and while I needled her SCM, it actually brought on her headache, but I stayed in there for a little while and it died down. And kind of like the plantar fascia patient, symptoms went away immediately, and I followed up with her in a week, and then the following week, once again, the symptoms never came back. It was fantastic.
So you're working for Athletico,
yes,
in the Chicago area. Can you tell me a little about how that works? Atletico offers our courses. How does Atletico benefit from the courses?
Yeah, so Athletico, I think I was the first cohort that got certified. There was about 30 or 35 of us that got certified through Myopain. And I think it's had a real good positive impact on the clinics that have someone that's certified in needling. It's helped grow their volume, and now myself and the other clinicians that got certified through Myopain now I think can treat a wider variety of diagnoses like TMJ, like I mentioned, acute or chronic injuries, chronic muscle or tendinopathies, things like that. So it's expanded the number of patients and conditions that we can all treat, which has been good for a lot of our centers.
Very good. Any concluding comments you may have? Or recommendations or things, whatever?
Yeah, I would say I would highly recommend Myopain seminars. It was a very tough training, but not only did you get great skills and evaluation and needling techniques, but a lot of good clinical reasoning on top of that to help decide which patients might benefit.
Okay, thank you very much.